So, welcome, Ginny. This is a lovely opportunity to talk about something very special in the world of herbal medicine. And thank you for coming along to talk us through some real world experience of women's health and working with women in the practice. Tell us a little about yourself. Where did you come into this herbal world?
Well, I came into the herbal world back in 2007. So I had done a medical science degree at the University of Birmingham, and was looking for my life calling, really. And at that point, my grandmother was seeing a herbalist. So I went along to one of her sessions on the advice of my father, actually. And I just finished a research degree and thought, seems a little bit off cuff, but okay, here we go. And off I went to Hyde's Herbal Clinic, which is where my grandmother was being seen. And I was absolutely blown away by the way that the consultations were run, the scientific background to everything, the bespoke prescriptions that were given, and the success of it. And actually, it turned out that my other grandmother had been to the same herbal clinic 10 years before for another condition that they got to the end of the NHS and had been left to live with. That was a chronic cough, which was hugely disturbing her quality of life, and herbal medicine did the trick. So I thought, hang on a minute, there's really something in this. So off I went and spoke to a few other herbalists. I'm very lucky where I was living at the time in the Midlands to have lots of herbalists around me and also herbal suppliers. So I spoke to a couple of other local herbalists. I spoke to Paul Chenery at Rutland Biodynamics to find out a little bit more about herbal medicine, and decided that that was the route for me. So off I went to university again for another 3 years. So I did the College of Phytotherapy course that was then accredited through the University of East London, and I qualified in 2007. I was fortunate enough while I was studying to work at Rutland Biodynamics for a while, which was brilliant. So now I have every sympathy for the suppliers when I'm on the end of the phone putting my orders in, saying, any chance you can get that out today? Because I remember the manic order scrabble at the end of the day. But that was brilliant to see how the herbal medicines were made. So then I was very fortunate to work at Hyde's Herbal Clinic for 7 years once I'd qualified. And then at that time I started my own family, and life changed a little bit, so I set up my own practices. So now I work out of a couple of locations in the Midlands, and I run clinics 3 to 4 times a week, seeing patients, and I'm very lucky they're busy clinics. And obviously we're talking about women's health today, and when you'd asked me about that, I thought my guesstimate is that I see about 80% women, actually. So I do a lot of women's health, and I went back through my clinic book for the last few weeks, and I was spot on. So
Yeah.
80% of my patients are women.
Interesting. Yes, because obviously I have a slightly different angle on this one. But I would say I have obviously more men in the practice because they probably orient a bit to a male practitioner. But it's 60%, I guess, in my case.
Yeah.
But I'm obviously having to learn from scratch every time, so I'm grateful to hear some of your stories. Interestingly, the Hydes are another thing we have in common, because it was the Hydes that brought me into herbal medicine, Fletcher Hyde, way back in the 70s. So I have a lot of, and we did some of our clinical training up there.
Fantastic.
So we have that in common also. So thank you again for coming.
It's an absolute pleasure, and it's so wonderful to have the opportunity to talk to people about what we do in clinic as herbalists in women's health. And women's health is becoming so much more of a thing at the moment. There's a new government initiative around women's health, following on from the 2021 survey, where they looked at 100,000 women, in the UK, asking them what their priorities in women's health would be. And I think that's been a huge eye-opener. And of course, lots of the things that came up are things that we see in clinic. So gynecological conditions, fertility and pregnancy support, menstrual problems, menopause, and we know that we're talking about the menopause so much more now, and nervous system health as well, so mental health.
Yeah. Well, I was always struck when I was growing up in this world how much what we are using is women's medicine. And historically, in many cultures, it was the women that did this work, because they were often the midwives and the doulas as well. They were the ones who were involved in day-to-day healthcare by various circumstances. And so we see, especially in some of the earlier societies, we see it was the women who were picking the remedies, and they were picking them for their own needs as much as anybody else. So,
Absolutely.
from the inside, so to speak. And so, herb for menstrual and menopausal and fertility problems are really thick on the ground, aren't they?
Yeah, they've been an absolute staple. And of course, in so many cultures around the world now, that still happens, doesn't it?
Yes,
Less
it
so
does.
in ours, perhaps, but
Oh, well, it's catching up. You just have to look at the membership of the herbal profession, and it's reverting back to type.
yeah.
Yes. Anyway, I don't know. We thought we might like to start with talking about one particular story, one patient, one presentation, and tease it out a bit and see what you've learned from that. And we can sort of put the questions backwards and forwards between us.
Yes, so I have picked a patient whose story to share with you today. The reason I have chosen this one is because I think it really demonstrates how we work as herbalists, and it was a sort of typical case of somebody coming in with a particular presentation and seeking help for a particular area of their health. And then actually when we had our consultation and opened that out, there are, as always, lots of other things playing into that. And I think that the wonderful thing about being able to spend an hour with our patients and having the luxury of the time is that we have time to examine all of that. So Alice was a 36-year-old lady that came to see me some time ago, and she'd been referred by somebody that had been to see me before, and she was struggling with fertility. So she had come off the oral contraceptive pill 14 months before, and was still trying to conceive. And she'd also noticed that she was feeling quite tired over the last 6 months, so she was suffering with some fatigue. So obviously we spoke through her gynecological history. She was actually put on the contraceptive pill at the age of 14, and that was for heavy and painful periods, and she'd been on it ever since. So a really long time to have those hormone controlled periods. And when she stopped her pill, the periods came back fairly quickly. She was having a regular cycle, and she was doing ovulation sticks that showed an LH surge mid-cycle that suggested she was ovulating, but she felt that the luteal phase of her cycle was a bit lacking, and the periods that she was getting were really quite scant. She had a one-day good bleed, but it faded off very quickly after a couple more, and she was experiencing a lot of pain. So she was in agony, so much pain that she was actually sweating and not able to get out of bed some days, and particularly she was noticing that was aggravated when she was trying to open her bowels. She'd already been down the route of having some investigations done. So she'd had an ultrasound, and her ovaries and fallopian tubes were patent. There didn't appear to be any problems with her uterus, although it was raised that she may have had a slightly thin endometrial lining on day 21, which was interesting and tied in with the sort of scant periods. But she had been referred potentially for some endometriosis investigation off the back of that. Her blood tests had all come back fine, so estrogen, progesterone, LH and FSH levels had been normal, but she hadn't had her prolactin looked at that time. So we spoke a little bit more about the history of her periods and things, and then a little bit more about her wider health. She was struggling with IBS at the same time, and every morning she was waking up with severe cramps until she managed to evacuate her bowels, but she was constipated. So good old type 1 on the Bristol stool chart, so pelleted and mucousy and really uncomfortable. But actually, other than that, her digestive system was unremarkable. We talked through diet, of course, and she'd got to fairly standard high grain diet. So she was having cereals and pastries for breakfast. She had a very busy job. It was quite stressful, very long hours. So it was a typical sort of grab food when you can. So cereals and pastries. She would have a sandwich for lunch, and then her evening meal, a lot of red meat, a little bit of vegetable and potatoes and things, not very much fruit. So quite lacking in fibre. She tended to have sugar cravings as well. She was also suffering with anxiety, and every morning she was waking up feeling like she got a tight chest and she was short of breath. So quite marked anxiety symptoms. She was worrying particularly about her health, about her fertility, and about the pain that she gets around her period, and dreading the next one coming along. And also, as I say, she was noticing particularly that she was feeling lethargic, but her sleep was actually very good. So she was getting a good sleep opportunity. She was allowing herself 9 hours in bed, which obviously is hugely important in terms of hormone regulation. But as I say, sort of lots of stress there. She had a history of depression in her 20s, but she felt that was more due to a situation that she was in at the time. And the other thing of note was that she was getting headaches. They weren't necessarily tied into her menstrual cycle, but she was getting a couple of headaches every month and some urinary tract infections, and she was also suffering with thrush from time to time. So quite a few things came up in sort of various different systems. She was already taking Proceed, so she was taking a preconception multivitamin, and actually when she came off the pill 14 months before, she had been diagnosed with low thyroid, so she was taking fairly low dose thyroxine at the time. So we had a good chat through all of that. The rest of her health was really quite good. But it was just one of those cases that comes up where instantly you feel like there are various areas that herbs would be fantastic for. And actually, if we can get lots of those different things moving better, then, altogether that would improve things and improve her chances of success at conception.
Were in good order, apart from perhaps towards the end of the luteal phase.
They appeared to be. She was having a pretty regular cycle. It was at 31 days. I say she was doing ovulation sticks, so she was getting an LH surge that suggested she was ovulating around day 15 each month, and she also was getting Michelschmerz. So yes, she felt that
some
she did mention that she was getting some electrical sort of sensations around day 21 as well, but yet the first half of her cycle seemed okay. She didn't report any pain at that stage. It was more sort of around the period, and actually after the period, I say apart from day 21, she was okay. But I think because of the IBS type symptoms and the fatigue and the severe dysmenorrhea, she was waiting for investigation into potential endometriosis. Yeah. And that was of consideration when I was putting together her herbal treatment plan.
So what was your first thoughts?
Yes. Well, we use the word pelvic congestion sometimes, don't we? It's a bit of an old term rather than necessarily anything sort of hard sciencey, but that was my gut feeling. It was that there was a lot of congestion. Things weren't moving around there. We needed to get her digestive system going so that she was, getting rid of any excess estrogen, and also to relieve this tension around that area. And obviously the sort of luteal phase, the scant period, I really wanted to get something warming in there to encourage pelvic circulation. So that to support the uterus itself. So the herb that sprung straight into my mind was, of course, Angelica sinensis, Dong Quai, which I think is a brilliant herb for lots of pelvic and gynae conditions because it's anti-inflammatory. I thought she was probably producing quite a lot of the series 2 prostaglandins, so trying to push down that anti-inflammatory pathway. It also helps to encourage the pelvic circulation, and I found it very useful in helping to encourage a good bleed, as we might sometimes call it. But when there is scant bleeding. But interesting with Angelica sinensis, I don't know if you find the same, but I also do use it in fibroids and things where actually we're trying to astringe and slow the bleed, but because it's a tonic and used alongside other astringent, it really is very helpful in that moderating.
The thing about Angelica is it was originally seen for congestion in all its forms, particularly in the pelvic area, and that includes, as you said, things like fibroids and other pelvic symptoms.
Yeah, absolutely. Fantastic. And because it's also a gentle laxative as well, I thought it ticked that box in helping to move things along, and also debility. So it was a really sort of top pick to help from all areas, really. Obviously, when we talk about the luteal phase, we often think about Vitex, Agnus Castus. So I gave her a good dose of 1-in-1 Vitex. I tend to mix that into the medicine for ease, and personally find it works just as well taken at any time of day. I know sometimes it's suggested that it's just taken in the morning. But I popped that into the mix, and that really was for luteal phase support, so to encourage the progesterone side of things, the development of the uterine lining in that luteal phase, and of course to ease premenstrual symptoms, because she was finding that a week before her period she was feeling really quite mood swinging and a little bit low. So to support the HPO axis, I popped the Vitex in there.
Do you consider vitamins and nutrients in that luteal phase at all?
Generally, I've supplement wise, she was already taking Proseed, and I put in some omega-3 fish oils,
of course, yeah.
To help with that and to push it down to the prostaglandin 3 pathway. Other than that, I wouldn't use anything specific. Is there anything that you would recommend at that time?
They always used to talk about various B vitamins at that stage of the cycle, and I don't know if the evidence is very strong. And evening primrose oils and so on have often been as tight as the game. The evidence is a bit weak, I think.
Yes, absolutely. And evening primrose oil I tend to use particularly for mastalgia, so breast tenderness. But yeah, B vitamins are often a top pick when working with menstrual cycle, particularly premenstrual symptoms and anxiety. So yeah, and she was taking quite a good quality preconception multivitamin that would have had some levels of B vitamins in there. So that was sort of covered there, really. I also put in some black cohosh.
Yes.
Now they say you choose herbs for people, not herbs for conditions, and that I chose that from a sort of quite a traditional perspective. It's got its anti-inflammatory properties to it. It's a sort of traditional spasmolytic and uterine tonic, and also because it can help with ovulation. As I say, the suggestion was that she was ovulating, but again with that scant uterine lining, I thought if we put some Simisofugia in just to help as a sort of traditional uterine tonic, and it's used sometimes to support ovulation alongside Clomid, and it's been reported to be quite useful in some studies there. So that felt like a really good choice there. So I popped some of that in.
Interestingly, it's also used in Native American as a bowel remedy. So nice tie over there.
Perfect. And we do, don't we? We notice sometimes that when you give it to patients, they do report that their bowels are a little bit looser. So yeah, in that mix, actually, I only put 10 mils in. Obviously, we were trying to get the bowels going anyway, but I'm sometimes a little bit cautious with that. But I put some cramp bark in there as well to help ease bowel tension. And obviously, the one of the key things that we really wanted to ease was the period pain, the dysmenorrhea, and it was quite a spastic sort of cramping pain. And of course, Vibop's quite good for anxiety as well.
Do you ever use Vib prunifolium?
I was thinking about that when I put this together, and I don't. It's not a herb that I stock in my dispensary, and I was asking myself why that was, and I think it's because I find that Vibop has always worked quite well, and I use that in lots of other conditions. But it did make me think that actually perhaps it's something that I should think about using. And I certainly remember in training that was the key one used for period pain.
I sometimes throw them both in together just to give a double whammy.
Are there times when you use Vibpru on its own?
Yes, I do see it as very focused on the womb.
The next herb that I put in there was chamomile as an anti-inflammatory, carminative, so really working on the digestive system, and that morning anxiety. I find it really useful in helping. Quite often I use it alongside black horehound, Bolota nigra, for that and sort of the vagus nerve. But on this occasion, I put just the chamomile in alongside some ginger. Again, lovely warming digestive remedy.
It was Fred Fletcher Hyde that reminded me that matricaria comes from the Latin matrix, which is womb.
Ah, there you go.
So it's again another clearly identified as a women's remedy once upon a time.
Yes, that will be why I use it by the bucket load. So I popped that in there alongside some ginger for several reasons there. So obviously pelvic circulation, anti-inflammatory, sort of warming to get things moving. And obviously that often helps with palatability, because we know that a lot of the women's health herbs don't taste very nice.
They don't, do they? I think is it some of the saponins that can taste quite lousy. Yeah.
Yes, absolutely. And I put a little bit of valerian in there as well, which personally I love the taste of. I know not everybody's keen, but I always think that lifts it a little. And again, that was to work really alongside the chamomile on the acute anxiety that she was suffering in the morning, and to help with the bowels, and also possibly just to have a go at the easing the headaches that she was suffering with as well. So that was the main mix that I gave her. I also gave her a pre-menstrual mix of ginger and cramp bark to start 48 hours before the onset of her period. And I gave her, I said, to take 2 to 4 meals 3 times a day from 48 hours before, and then when her period started, to continue at that dose, or she could increase it to every 3 hours if she felt that she needed to.
So what happened?
Well, she also made some good dietary changes, because obviously there were some bits there, and I think that will have helped enormously in sort of how she got on. So she was eating a lot of red meat, so we reduced the red meat. We went a little bit more Mediterranean diet-wise, so more fish, plenty of fresh fruit and veg, a good old tablespoon of flaxseed on her breakfast in the morning to help encourage her bowels. In my experience,
and also linseed also has its own benefits for the women's metabolism as well.
Yes, absolutely. I encouraged her to split them if she could, because obviously all's the better if time allowed, and obviously if you're sort of looking for that action, that's particularly important, of course, isn't it? But she was happy. She embraced the dietary changes that we made. Also, in my experience in thinking along the lines of endometriosis, I found a lot of patients there in the dietary changes have benefited from taking gluten out. Especially when the diet is quite so high in gluten. I always do that.
And when the bowels are also involved.
Yes, absolutely, because it's irritating to the digestive system. So I tend to suggest that as a temporary measure. Take it out, see what difference it makes, and then look at trying to put it back in, and usually at a lower level, because I think it's not a bad thing to have little bits of, but obviously we have a lot of it, and particularly her diet was quite high in that. We talked about dairy and just trying to go for organic if she could, and not having too much of that again. And I also suggested kefir, which obviously is dairy, but from a microbiome probiotic perspective, again looking at bowel health, inflammation, immune regulation. You see there's a thyroid issue in there as well, so potentially that autoimmune link. So she did all of that, and she also took some high strength fish oils, so again to try and reduce the inflammatory prostaglandins. She was very compliant. I think she really felt the benefit, so I asked her to come back and see me 4 weeks later. And she was doing
where was she in the cycle when you started this treatment?
She was fairly. So when I saw her again 4 weeks later, she was day 26. So she was sort of quite late on in the luteal phase. Yeah. But interestingly, something sort of kicked in really quite quickly. Obviously, she was taking the cramp bark and ginger mix as well. But I saw her after 4 weeks when she was day 26 again. She'd not had any of the bowel pain when she was opening her bowels. Her bowels were soft and regular. Her energy level was better already. She wasn't waking up in the morning with those sort of acute anxiety symptoms, so the sort of chest pains, shortness of breath, and digestive upset. She'd obviously had a bleed, but it was quite soon after I saw her. It was a 4-day bleed, so she had felt already that it was better, and actually she hadn't had any pain to start with. She got 30 minutes. Oh, normally she'd have quite acute pain on day 1, so it it had really shortened it and pushed it to slightly later on in the bleed. She'd had her usual Michelschmerz ovulation, and she still had that sort of electrical feeling in day 21, and she hadn't had any headaches. So she was really pleased, and I think it's brilliant when after 4 weeks you can see a good improvement, because it spurs on with all of the taking of the unpleasant things and the dietary changes.
Because so often I find it takes 3 cycles to turn some of these things around. I often project that to avoid disappointment, and the first one doesn't behave itself. And sometimes I even say the first cycle is going to be different because we're still shaking things around a bit. But
Absolutely.
you may not expect it to be wonderful, but you hit gold there.
Yeah, but as you know, sometimes that can happen in the first cycle, and then you get the next couple of cycles aren't as good. And so, I'm exactly the same. I tend to say sort of a good 3 months, and we'd agreed a 3-month preconception plan, so that I had complete free rein on the herbs that I used as well. And so, of course, we had that conversation. Said that's brilliant. You'd only had your herbs for a couple of days at the time of your period, but obviously the rest of the improvements she'd noticed throughout the month were great. She was due for some repeat thyroid tests, and a few other blood tests were in the pipeline. So I gave her 6 weeks worth of medicine in the plan that she'd have a couple more periods again before we saw each other again. And so we got together again 6 weeks later. So that was 10 weeks after the onset of treatment. So still in our sort of preconception treatment phase. And she'd had another sort of really manageable period again, 4-day bleed. And she felt that she was getting a much better bleed and a good bleed for 3 or 4 days rather than 1 day and then a little bit scant, much more manageable. She was using the cramp bark and ginger and taking it more frequently during the day as and when she needed to. She felt like her anxiety was under really good control. Work stress was an issue, so she'd had a couple of episodes of anxiety, but she felt like they were much more controlled and shorter lived. She'd had some blood tests, so they were interesting. Testosterone, sex hormone, binding globulin were all normal. Prolactin was normal, but interestingly, it was slightly towards the top of the normal range. And as you know, as herbalists, we always like to look at the blood tests and, when things come back as normal and just see where they sit. So I thought that was interesting. Obviously, from the Vitex perspective, we don't know what her prolactin levels were like before she started, but I just made a mental note that they were sort of top of the normal range, because, we can use Vitex to help lower sort of higher levels of prolactin. Her thyroid function was still slightly low, so she just had her dose increased slightly to 75 micrograms, and she had been referred on to fertility clinic and again for endometrial investigation, but she was feeling really positive and really good. Now, she hadn't had 2 periods since I had last seen her. She'd just had the one. So she was due to have a period around that time. So rather than prescribe another course of the same treatment, we agreed that she got a little bit left to see how that period went, and then I could prescribe some more medicine accordingly, and we can move on to medicine to take while she's trying to conceive. But in this occasion, happily, 2 days later, she messaged to say that she had got a positive pregnancy test and was already pregnant, which was fantastic news.
It is. So what do you think was going on to prevent her being pregnant? What was the fertility issue as far as you could work out?
Well, I think it comes down to that sort of pelvic congestion thing. Sometimes patients come in asking for fertility support, and you can take a case history and everything can seem to be exactly as it should. And that can be particularly tricky in this case when somebody comes in and there are several areas, particularly around the pelvic area, that you think actually we can optimize that, and often that's what it is, isn't it? It's rebalancing and optimizing. All of the tests that she'd had come back as normal. There's the element of stress in there, and calming the stress. Yeah, absolutely. Encouraging elimination through the bowels, relieving tension.
And the bowels improved along with other things and all this today.
Yes, absolutely. Fairly quickly.
There was what in the old days when women's health books were written by men. There was famous gynecologist who said that he was always got confused between bowel and womb symptoms, that they were often very difficult to untangle, which
Yes.
I suppose a bloke could get away with saying. But there is a confluence, isn't there, that they do share similar. Apart from the geography, they share similar behaviour as well. So if you get one working, often you ease up on the other.
Yes, absolutely, and that can include bladder as well, often.
Yes,
as
of
well.
course.
And
Yeah.
This patient had been getting urinary tract infections.
UTIs.
She didn't have any during the course of her treatment. So
was there any thrush around in your story?
not when I was seeing her, but in the case history, she said, when she got sort of UTI and thrush together.
Yeah.
So that could have been due to, again, sort of stagnation,
that speaks to
diet.
congestion itself, doesn't it?
Yeah, absolutely. So it was really pleasing. But as you say, some cases respond really quickly. Others often do take longer. And obviously, we'd agreed that she wasn't going to try and get pregnant for 3 months, but sometimes people can't wait. But a really lovely story, and I say quite a good one at just showing the sort of bits that you can put together, and how we do function as a whole being, and looking at all of those different elements can be enough to.
Indeed. I do sometimes think that we've unwittingly or otherwise added to the human population by the number of our patients who have struggled with being pregnant, who have become pregnant.
Absolutely, yes. But a really lovely way to do it. And also I hope that the changes that we've made will also help her health moving forward as well, because that anxiety and digestion, even when you're not trying to conceive, is not something that you necessarily want to continue living with.
So take us through what happens next. I mean, not necessarily with this patient, but generally when your patients become pregnant, what do you do? Do you sort of stand by? Presumably we don't go marching in there with big boots on, but
no, it entirely depends on the patient, and also what's gone before. So in patients that have a history of miscarriage, often that comes around 10, 12, 13 weeks.
Where would you start with that sort of case? Someone who's lost babies before.
Mm-hmm.
When do you start? That's an obvious point. And what sort of approach do you bring to such cases?
Again, it would depend on the case history. So again, ideally that 3-month period where we put a pause on trying to conceive and actually optimize gynecological health. Again, taking that case history and looking at areas, obviously, with miscarriage, often it's unidentified as to why that might be. So again, work with that individual patient on optimizing their health and just increasing chances of conception. And then, we work incredibly carefully when patients are pregnant. I do tend to use miscarriages. I would use quite simple herbs, so vitex, chamomile, ginger, up through to about 16 weeks, especially if they have lost babies at around the 12-week mark, when the placenta starts to take over. So it depends on a case by.
We always try to get through the first 3 months without interference, don't we? There's another one or two couple native British remedies that sometimes are used for this situation. Alchemilla being one.
Yes.
Very gentle. Balota has been used as very gentle preventative of, and the viburnums again, again later in the as closest to the end of the first trimester as you can get.
Yeah, absolutely. And we always work incredibly carefully. And as I say, some patients, this particular patient had some morning sickness, so had some support for the first few weeks, but then felt like she was away and wanted to do it on her own, so didn't have any other herbs during pregnancy. Sometimes people will have a mix early on, and then come back for something simple like some raspberry leaf as partus preparator
Yeah.
in the last few weeks of pregnancy.
Yeah.
Which, I do quite often give. But yeah, I generally try not to treat in pregnancy unless there's a reason to.
Absolutely. Yeah. Yeah. Basically. Do you get involved much in the later stages of pregnancy with some of your patients? You don't do a doula job?
I don't do a doula job now. I do have some raspberry leaf if you'd like it, and please tell me when your baby arrives. And I did have a lovely, lovely one arrive this week of a little girl that was born, and it's just such a lovely feeling, isn't it? You just think that's absolutely amazing. The healthy arrival, and this particular patient went on to have a baby boy, which was wonderful.
So why don't we go through the cycle a bit further then? So a new baby's arrived, issues around nurturing, breastfeeding, lactation, baby's health in general in those first weeks. What's your experience in working in that area?
Yeah, to be honest, I don't have that many patients coming back in with their babies. I've seen a few over the years, perhaps more with colic problems. And again, when patients are breastfeeding, I work very carefully. Probably, if obviously they're breastfeeding, through herb teas for mum or tinctures for mum. Things like chamomile and fennel as sort of gentle carminatives, perhaps a bit of meadowsweet.
Yeah, I
if
just
there's
had
reflux.
Yesterday I had a patient who was
I don't tend
2 months
to
old,
give
who was still being fed, obviously, by her mother, and we decided, and she had very bad eczema, and it wasn't food related because she'd been through all that. So we decided that we would treat the mother, and then get the herbs passively, so to speak, through the mother's milk. But spices often come up in that context, so as well as you mentioned fennel, but other spices also step up in those post-natal weeks as a way of treating the baby through the mother, because you can sometimes settle the bowel and settle the gut and help with other digestive upsets, and as well as building strength by adding a bit of spice.
And which are your favourite ones to use? What would you put in it?
Well, I got a handful of favourites. Cardamom always keeps stepping up as a strengthening one. The cinnamons, gingers, of course, coriander. What's the other ones? Brain suddenly. Turmeric, of course, but I don't give that as a tincture. It's because it's far too yellow.
Yes. Yeah. Well, how about fenugreek?
I haven't